After graduating from medical college in Pakistan, Dr. Azim Khan completed a residency training at Cook County Hospital in Chicago, which is the busiest public hospital in the United States. Most of the top-notch doctors in the United States have been trained there. He trained at Northwestern University Hospital in Chicago, where he did his wound healing fellowship with world-renowned dermatologist David Woodley. Northwestern University is one of the best universities in the United States. Dr. Khan trained with world-renowned wound healing specialist Dr. Richard Clark and received training in dermatology at State University of New York at Stony Brook, becoming an assistant professor in dermatology. He is still working in that capacity and delivers lectures to students and young doctors a few times every year. Dr. Khan also trained with two very famous cosmetic surgeons, Dr. Bisaccia and Dr. Scarborough. All of the doctors that he has trained with are authors of textbooks. And Dr. Khan himself is editing a textbook of wound healing with Dr. Richard Clark, ex-chairman and director of tissue engineering at Stony Brook University Hospital and Medical Center. Dr. Khan is the first American-trained, board-certified dermatologist and cosmetic surgeon in all of South Asia. Many people feel that the eyes are the window to the soul, and I know that you can do many things to improve the appearance of upper and lower eyelids with cosmetic dermatology. Can you tell me a little bit about those procedures?
The eyelid beautifying surgery basically can be done in two ways. If the upper eyelids have small laxation of the skin or laxity of the skin of the upper eyelids, can be corrected by taking away the extra skin. That is a very, I would say, easily done procedure on outpatient basis. By the way, all our surgeries are done outpatients. You don't have to be admitted in the hospital. You come in and go out the same day, probably within a few hours. The upper eyelid surgery, which is the upper blepharoplasty, is essentially a technique where we take away the extra skin from the eyelid and sew it back together. The lower eyelid surgery is usually reserved for the cases where you can see a lot of lower eyelid bags, and it gives the appearance to the patient as if patient is very tired. And it is a remarkably satisfying surgery because people start feeling looking fresh after the surgery, because the lower eyelid bags are usually taken as the sign of tiredness. That technique also, the way we perform is the I would say the state-of-the-art way, because we do not leave any mark on your skin. We go from inside the eyelid and essentially take out the fat, and you go home the same day.
Dr. Khan, tell me about your qualifications in cosmetic surgery and dermatology.
After graduating from Allama Iqbal Medical College in Lahore, I came to the United States and did a residency in internal medicine at Cook County Hospital, Chicago. Became board certified in internal medicine. Then I did a fellowship training in wound healing at Northwestern University Medical Center and Hospital, after which I did a dermatology residency at State University of New York at Stony Brook. I also performed a fellowship over there in wound healing with Dr. Richard Clark, and then I became a faculty over there. I became assistant professor in dermatology, which I am as of today as well. I still teach there. After that, I actually did a fellowship in cosmetic surgery with Dr. Emil Bisaccia and Dr. Dwight Scarborough. Dr. Emil Bisaccia is a professor of dermatology at Columbia University Hospital and Medical Center. I am board certified in internal medicine, board certified in dermatology, and I have performed a cosmetic surgery fellowship, which is approved by American Academy of Cosmetic Surgery.
Well, Dr. Khan is a very accomplished clinician, clinical scientist, and surgeon, and I suppose the most significant thing I could say about his clinical care is that I would be most happy to be under his care, and I would be most happy for my family to be under his care.
Dr. Khan is one of our very accomplished graduates. He's done his additional year of derm surgery, cosmetic dermatology training. Prior to that, he spent many years working with research in this department with Dr. Clark. He has boards in medicine and dermatology in the United States, which is more accomplished than I am. I only have boards in dermatology and dermatoimmunology. So he is a very accomplished physician with a very extensive training both in medicine, dermatology, and dermatologic surgery, including cosmetic dermatology.
Tell me a little bit about cosmetique in Lahore, Pakistan.
I always had the dream of creating a state-of-the-art center of dermatology as well as cosmetic surgery in Lahore, where I came from. So to pursue that dream, after staying in the United States for about 15 years, we have been able to create such a center in which we have tried our best to pick every single thing from a needle to a laser, and we have paid attention to the finest details, that they are the state of the art and they are the finest, not only in Pakistan but also you can compare them with any standard, international standard. By any international standard, they are the best as far as the equipment goes. So it's the state of the art, I would say ultra modern, best equipped facility, not only in Pakistan but also in the whole South Asia or Asian region. I can almost say that without any doubt. Also, the staff is being trained and picked by me, and I have paid attention to the greatest detail that they do the things right and at a standard which I am used to in the United States.